I am happy to introduce Sheridan Nicolau. She is the State Council Regional Manager for the Bay Area office. This office covers the Alameda County, Contra Costa County, Marin County, San Francisco, and San Mateo counties. And as the regional manager, she, like me, is dedicated to improving the quality of care for people with developmental disabilities and the developmental service system. We do it in a variety of ways, and tonight Sheridan is going to do it in one of her most exceptional ways, which is to do this training and to inform our community. With Sheridan tonight is Elizabeth Grigsby, who I believe I've met on a couple of occasions. She is a chairperson. Is she the chair of the Regional Advisory Committee over there at the Bay Area office? Our Regional Advisory Committee works somewhat like a board of directors. We meet regularly with them, and they advise the staff of the State Council on things to do and directions to take. Elizabeth is going to share her experience as a self-advocate. So we're delighted to have Elizabeth here. So with that, I turn it over to you, Sheridan.
Wonderful. Thank you so much, David. And I see, and I know Elisa will take a look at that too. It looks like at least one person, if not more, might need some additional help to find the interpretation buttons. I know Stella's in there because we can't hear Stella, so we know she's in the Spanish room currently. And thank you again, Stella, for being here for us. So everybody, we have so much content for you all, and we want to be mindful of how to best spend our time with you. And so I want to map out a little bit about what we're going to do and some of the things that Elizabeth and I will be sharing with you. Okay, and for some of these slides, we have some Spanish interpretation on the next slide. And then for other slides, we have a title that's bilingual, English and Spanish. And we'll send the decks to you. So you will get all of the materials that you see today. You will also get a handout in English and in Spanish, which is like a cheat sheet on the top tips for advocating for generic services. Okay, so everything you see tonight, you're going to get in an email. We're going to send it to Parents Helping Parents, and you'll get it. So you don't need to do a bunch of writing this evening. We also want to make sure that Elizabeth and I are setting expectations properly. We would need 5 hours if we were to go through eligibility and appeals criteria for every single system that we're going to talk about today. We're not going to do that. What we're going to do is we're going to give you a big picture structure of how to think about navigating generic services and regional center services. We're going to give you examples of generic service systems and who uses them, how you might use them, how you might start to sign up for them. We'll talk about regional center services and general categories of what's offered. And we'll talk a little bit about how to use those different systems of care and a little bit about how to negotiate and to work around the regional center being a payer of last resort. So what that means is that you're going to get a lot of information, and it's going to be covering many things. So if after tonight you would like more help on your specific case, your situation, your loved one situation, let us know, okay? And we can talk with you. You can contact David's office, my office, or we'll put you in contact with the local state council office, and we can talk more about your specific information and give you some recommendations that are right for you. Okay, and we're also going to share a lot of links to advocacy resources and places to get more information about all of the systems and services that we talk about tonight. Great, and Elizabeth is here, my partner in crime. As you heard from David Grady, Elizabeth Grigsby is the chairperson for the Bay Area Regional Advisory Committee. She also works for a regional center. She also uses generic services. So talk about an expert. So there will be times when Elizabeth is going to give comments. She knows we have a lot to cover. So you're not going to get long stories from me or long stories from her. But what you're going to do is she's going to pepper in and remind us of what to focus on. right? And yes, we will be sharing everything you see tonight on your screen, you will get in your inbox from Parents Helping Parents. So don't worry about that. Okay. And there's a little bit about what we're going through today in Espanol. All right. So about your partnership. So Elizabeth, here's a chance. Can you share a little bit about your role, both as a regional center professional and as someone who also uses generic services? Can you share maybe a minute worth of information with us about that?
Yes, thank you, Sarah. My partner, Brian. Yeah, I'm a client at one of our local regional centers, and I also work for them. I'm employed by them. So I was a client first before I became an employee. So the best way I can say, when I started at the regional center as a client, I was a teenager. I didn't know what I wanted. My mom did everything. So if you ask me at my IPP, what kind of services do you want or did you want? I was like, I don't know. I didn't even know I had the right to ask for what I wanted. But as I got older and my mom got older, I knew my needs and wants were a little bit different from hers. I knew I wanted to move in my own apartment. I wanted to be in supported living. So first, I had to convince my social worker that I was ready and that I knew what I wanted. And through a friend of mine that used to work for the state council when it was called area board back in the day. She helped me write out my whole plan about wanting to move on my own and live in my own place. And I knew it wasn't gonna be easy. I knew I was gonna get pushed back. I knew I was gonna have obstacles in my way, but this was something that Rosie L. Smith knew I could do. And by her helping me, I had the confidence to speak up for myself and say, yes.
So Elizabeth, when you got that help to develop a person-centered plan for how you wanted to live life as an adult, I'm betting that included regional center services, generic services, and natural support. Is that correct?
Yeah, because I still have to use IHSS, which is a generic services. So I had to use all those services, and I'll be the first one to tell everybody it's not easy, but it's worth it to go from the regional center to generic services, you think, well, why can't we just have one service do everything? But this give us choices, because we all know the regional center can't do everything. I used to think they could. I used to think they could take on the state, until I got to work for them. And I know they work really hard to get the people that they serve what they need and want, but they can't do it all by themselves. It takes a village.
Let's talk with them about that village, so to speak. Okay, let's walk them through. So before we dive into some specific examples of generic services and regional center services and how that works, we want to at least give a very brief overview of what are some of the sets of rules and regulations that cover these different services. So, first we wanted to share just that the State Council on Developmental Disabilities exists both in regional center, in Lanterman Act state law, as well as federal law. For anyone who's interested, here's the federal law, the Developmental Disabilities Assistance and Bill of Rights Act, that basically puts together state councils and organizations like Disability Rights of California and University Centers for Excellence in Developmental Disabilities. Has that in every state and US territory. Okay. And then this is that in Spanish there. And the state set of regulations is under Welfare and Institution Codes 4500. And that is the Lanterman Act, the Lanterman Developmental Disabilities Act. And there is where you can find a lot of the information that we're talking about tonight about why you have to use generic services first and why you use them with regional center services if you qualify for regional center services. So we want to make sure you have that information.
They go hand in hand, or they should go hand in hand.
Yes. And I'm going to fast forward through some of the roles of the State Council because we have so much to share. And David shared a little bit about the focus of the State Council. And we're concerned with and partner with people that fall under the large umbrella of developmental disabilities based on the federal definition. So we support people that are both served by regional center systems as well as people that aren't served by regional center systems. And we're going to get into definitions, folks, of what generic services are for those that don't know, okay? So when we talk about people with developmental disabilities in the state of California, the larger federal definition, that's covering about 640,000 Californians, if that gives you a sense of the work. In our regional offices, David's, mine, and 10 other regional offices across the state are here for you all, not just to provide supports and education and technical assistance, but to help our communities with capacity building so that they can better stand up for each other's rights and to make for better systems for all people, including people with developmental disabilities. We also work on systems change and policy development to make sure that all systems can better serve people with developmental disabilities. Okay, so Elizabeth and I are going to talk a little bit about the big picture. These are the things that you want to be thinking about as you're starting to navigate different systems of services. And when we say different systems, we mean all of the different programs or systems that will pay or support for services for you or your loved one. And because many of you tonight have transition age youth or school age youth with you, or maybe you're a young adult, we're going to talk a little bit about that time frame, but the information that we're sharing is good for anybody of any age. So many students and families describe the transition from childhood to adulthood a little bit like they're skydiving or falling off of the cliff. And that's because so many young people and young adults don't necessarily understand that going into a transition process means that they will have to be the primary drivers of building that adult life and the services that come along with it. So more so than during school district days, preparing for adulthood, so transition years everywhere from ages 13, 14 years old on up to when somebody exits a school system, that's where you will see a student and their family advocates start to take a greater and greater role about designing the next steps. And we just want to point out that transition is a verb. It's not so much a destination. So you or your family members have had relatively a set type of processes within school districts. You know who you're working with at that district or at that school. In transition, you're gearing up for a whole new set of services and teams that are out there that may not be connected or talking to one another at all. So you truly become the hub, whereas maybe your district or your school or your educator might have been more of a hub for you in the past. Transitioning to adult services, whether you have regional center or you don't have regional center, either way, you and your loved one become more of the center of all things because you're probably going to be getting supports and services from multiple places, multiple funding sources. And that's what our conversation is this evening. Okay, so when we say a results-oriented process, that transition is a verb and that it's results-oriented, the result should ultimately be a meaningful life. And so it should include a home where someone feels loved and at home. It should include meaningful work of some sort, hobbies and interests for that person, a sense of community or communities, because most of us belong to multiple communities, not just one. And it should have that blend of security and exploration and interdependence. And for those that are less familiar with that term, interdependence is healthy, and it means that we all benefit from and lean on one another in different ways. It's mutual dependence for success. So some of those building blocks that we're talking about when you start to plan of what you're going to need to have a successful adult life, these are just a few things. If we had more time tonight, we would go through various categories of housing and housing related support services. We would go through various categories of employment and employment services. We would talk about different community-based programming, different social and recreational opportunities, different healthcare systems, different rights education and advocacy planning. So we're going to cover those categories, but we're not going to do the deep dives that you will need to do along with your loved ones or your circle of support to make sure that you're not missing anything in terms of looking at all both regional center services and generic or non-regional center services that might help meet your needs or your loved one's needs. Okay, and what's important, and these are those building blocks that we're talking about. What should you be thinking of as you're thinking about those building blocks for success? You should definitely be thinking about, and Elizabeth brought this up, you know, who is around you, right? Who is there to support you in building your plan, in doing some of the person-centered planning work. So Elizabeth, for example, you mentioned that you had family that had supported you growing up, but it was as you were a young adult that you needed more people from outside of your family in your circle of support to help you with person-centered planning, because your vision for your adulthood looked different than your family's vision for your adulthood. Is that correct?
My family would have always said I couldn't live on my own. I couldn't have the dream like my brothers and sisters had. But this one organization believed in me, and that's what is called the state council now. But back then it was Area 4-5. This one lady believed in me, and it took that one lady to instill in me that I had the right to live on my own and make my own choices. And that just blew my mind wide open. I was like, wow, I have a disability, but you mean I can live on my own and go to school and have a life in which I want? That was amazing to me.
Yeah. And you were lucky and had that support in your late teenage years, early adulthood. But it's never too late. It's never too late to go back and do some good person-centered planning, to develop a new plan, to have new people on your circle of support, right? Like, it's never too late. And quite frankly, you should be continuing that work, that person-centered planning, and looking at your circle of support. Some people do it multiple times a year. Other people every year, they make time to work on that, right?
I'm doing that right now. That's what I tell other people. Other people at the regional center. Everything changes. So every year, if you have a goal and all of a sudden you tell me I want to do something else, I decided to put that one goal on the back burner. That's okay. You can change your plan.
Yeah. And I want to share something by the National Center on Secondary Education and Transition. So what I'm about to share with you is focused on transition, but it's good for any age, okay? So I don't want, for those folks that aren't in or don't have loved ones in transition age or young adulthood, this still applies. And that is that, remember that person-centered planning strengthens a transition from one phase of life to another, including from, school activities to post-school activities or adulthood. And it does that in a few ways. It's about enhancing the quality of assessment and planning activities for the person, being able to look at adult services that are providing the person with disabilities different services and different kinds of services, and we'll talk about those. It's about fostering positive working relationships between families and professionals. It's about finding a way for educators and case managers from other agencies to better coordinate services. And gosh, we could spend a whole evening just talking about some of the strengths and tips and the challenges that come with care coordination and service coordination, especially when you're working with multiple systems of services.
And you have a great picture here, Sheridan. services in your life is like building a house. First of all, you're the center of the person-centered planning. It starts with you and your vision, and then everything else goes around it. But you're the foundation of it all, because it starts with you and what you want to get out of your life.
Yeah, that's a great point. So let's dive into some key generic systems of supports and services and natural support. Okay. So what exactly do we mean when we're talking about generic systems? Okay. So oftentimes when you hear the word generic systems, that means in the context of whether or not somebody has regional center services. So there's a regional center system of services, and then there are generic services, which encompass many different types of programs and funding sources for different supports or services that might help you or your loved one. These generic services could be federal, they could be state, county, they could be private sector systems, and it could be things that are providing services, care, equipment, coaching, supports. So we're talking about many things, not just a service like a therapy service or a transportation service. This encompasses many things. It's important to know, and you probably already know, that every single program we're going to talk about has a different eligibility criteria and their own systems, okay? And they may or may not be linked to other generic systems. We're going to talk about some that are linked, okay? So for example, some programs of Medi-Cal or Medicare are linked with other governmental benefit services from Social Security Administration. So the key here, everybody, is to find out or to make notes for yourself of what you want to look into, what you know that you or your loved one has now, but services and supports that you don't have or your loved one doesn't have, but might qualify for, that you want to look into, because the more generic services that you can access, the better, whether or not you also have regional center services. Okay, so that's kind of a big bottom line there, is the more that you can get access to, the better, even if you don't use them, finding out what you might be able to use. Okay, and when we talk about generic systems of services as referenced to regional centers, the Lanterman Act has some parts of it that very specifically talk about that. Okay, so very specifically, Welfare and Institution Code 4659. We're not going to read all of it. Don't worry. We don't want to put you to sleep on a Wednesday night. But it talks about how Lanterman Act requires regional centers to provide services in the most cost-effective way possible, and to use all other resources, including generic services, also including natural supports, before using regional center funds. Okay, so the law says that. Okay, Lanterman Act. The regional center is the payer of last resort. So all generic resources must be exhausted prior to the regional center consideration of funding for a service. That's the case for both traditional regional center services or for self-determination services offered by the regional center, right? Because there's a few different ways that people can get services from regional center. All of those ways are also tapping into this, that you need to be able to access generic services, whatever you qualify for, to access those first before using regional center funds to pay for the additional supports or services needed.
Sheridan, for instance, I got supported living services that's funded to the region, vendor to the regional center.
Mm-hmm.
But I also have to use IHSF services that's not funded to the regional center for my personal care. And even though I get staff through my supported living services, I get staff to IHSS, and sometimes they overlap,
Mm-hmm.
so they could be in my house at the same time.
Mm-hmm. And you also have other generic services, like you use Medi-Cal, don't you?
Yeah,
Yeah, so that's yet another category. We'll talk about that. So this is just one example. There are several parts within Lanterman Act and that you can read in that link that we shared with you that talk about how the regional center has to make sure that people are using generic services before they get regional center funding for a certain something. And so one excerpt says, regional centers shall not purchase any service that would otherwise be available from Medi-Cal, Medicare, the Civilian Health and Medical Program for Uniform Services, in-home support services, California Children's Services, private insurance, or a healthcare service plan when a consumer or a family meets the criteria of the coverage, but chooses not to pursue that coverage. Long and short, it says, it's good to find out what you may qualify for, because the regional center is going to want to be able to see, they have to be able to see that you have applied for and have used any coverage that you qualify for before you use the regional center funding for what your needs are, okay? So there's other excerpts as well that we won't go into because I want to move along to other examples, but you can see there's many more excerpts within Lanterman Act that explain what that looks like. So for example, one part shares that regional centers may pay for medical or dental services during the following periods: while coverage is being pursued, but before a denial is made, pending an administrative decision on an administrative appeal, if the family has provided the regional center with verification that this is the appeal that we're working on, until the commencement of services. So what it means is, if you're working to get services or treatment or care from a quote generic resource, and you're running up on delays and denials or issues where they're not sure if you qualify yet or not, that the regional center in some cases has some flexibility to work with you, particularly if you have an urgent need, okay? So we're not going to go into all the places in a welfare and institution code that talk about that, but we wanted to point out some of those there. Okay, so let's go into examples of generic systems of care and services. So these are the types that you're going to want to think, do I know about them? Might I qualify for them? Let me go and research and apply to see if I qualify. Okay, so we're talking about Medi-Cal, Medicare, private health insurance, SSI and SSDI, those are programs, two programs from the Social Security Administration, California Children's Services, and then we can't forget the big old category, free and low cost community programs. Those could be private sector or public sector, like through the county or the city. And there's a whole bunch of them, right? So those are some of the things. We're also talking about special education or district services. We're talking about in-home supportive services, or IHSS, and Elizabeth already shared a little bit about that, about her experience with us. We're also talking about county mental health and behavioral health services, California Department of Rehabilitation Services, those are services specifically for employment, and CalAble accounts. All right, so this slide and this slide, this is your hit list. You want to go through this list and learn a little bit more, and we talk a little bit more about them. So you'll have this deck to give you a few notes and links, but these are some of the big categories of generic services that we want to make sure that you're looking at. And you should make sure that you're looking at these whether or not you or your loved one qualify for regional center services. All right. Now, you heard us talking about natural supports. So that's another category, right? So we talked about regional center services, And we'll talk about examples of regional center services a little bit later on. We talked about generic services, and we're going to go into a few details there. And then the other category is natural supports. And natural supports can be anything from services and supports from family and friends, from neighbors and neighborhood communities, your faith-based services and places of worship or church services, and natural supports of other kinds. And when we talk about natural supports, those might be free or low cost or some negotiated rate, but generally it's between you and that natural support who's in your community, your support circle, usually personal or community-based or faith-based, that kind of thing. All right, should we look into some deeper examples of generic services? Are we ready for that, folks? Okay, let's go in there. So first of all is Medi-Cal. And if people can, whenever we talk about a new generic service, when we have it on the screen like this, can you raise your hand briefly or give a thumbs up, maybe a thumbs up, so that David can look at everybody in the room tonight and get a sense of how many people are already on Medi-Cal or know about Medi-Cal. That will be helpful so that we'll know what kind of details to go into. Okay, so I see some hands raised, yeah. And then make sure to lower them after you've raised them, or you can do a thumbs up and then the thumbs up goes away on its own after a while. Yeah, so just for those that aren't in the know, and there's a link that will help you. So Medi-Cal is an asset or an income-based service. So income and assets are related to the eligibility. That is one part of the eligibility, okay? So it can cover children and adults with limited income and assets. It includes preventative and wellness services, behavioral health, referrals to specialists, emergency care, vision, dental. Oftentimes, but not always, Medi-Cal is coupled with SSI, otherwise known as supplemental security income. We'll talk about that. And for anybody that is dually insured, meaning they have private insurance and Medi-Cal, Medi-Cal pays after health insurance. So health insurance, private health insurance is the first payer. Medi-Cal will say, we're the payer after that. We're the payer of last resort if you can compare us to private health insurance. And so there's a few different eligibility groups. We're not going to go into that because it's quite lengthy. There's many different ways that people can fall into different categories of eligibility for Medi-Cal, including there are some eligibility groups that are not tied to Social Security. So if you're looking at the eligibility for Medi-Cal, and let's say you look into it and you see that you make too much money, but otherwise you fit all of the eligibility criteria around disability and other aspects, you might qualify for Medi-Cal within a certain threshold where you might just have a little share of cost, right? So maybe it's not free, but there's a small share of cost. A great resource, and we'll give you that website in a bit, is Covered California. Covered California, you've heard about this. It's the healthcare marketplace. It's a website that has a tool that will walk you through what you qualify for healthcare. Medi-Cal, share of cost Medi-Cal, what eligibility criteria, or certain discounted plans or plans where you have a smaller cost share than you would if you were to buy on the open market. Those are a few, not all, but a few of the services that Medi-Cal covers, all right? So all kinds of different services, including durable medical equipment, wheelchairs, walkers, medical supplies, nursing facility stays. All right, Medicare, thumbs up for people that either have Medicare or are pretty familiar with Medicare. So we know who we're talking to here. So thumbs up if you feel like you got a handle on Medicare. So most.
Uh-oh. Sheridan, we see your camera's turned off and your microphone is turned off. I'm wondering if you've lost your connection or if it's just a bad connection. But I'll pick up where she left off. Oh, there you are. Hi, Sheridan.
Oh, can you hear me?
Yeah, you're back.
I had a little unstable connection for a moment. Thank you. So for Medicare, most beneficiaries are folks that are 65 years and older, And with adults with qualifying disabilities or medical conditions, there's again another set of eligibility that's different than Medi-Cal, okay? Two different programs. One of the key is Medicare is not means tested. So it means that for people that make too much for Medi-Cal, they might qualify for Medicare depending, particularly if you have a lot of years of tax paying through work, or if you're a person with a disability and you have a parent that has paid a lot of taxes into work. In fact, Medicare is oftentimes associated with SSDI, and we'll talk about that. And there's some details there. So there are different programs associated with Medicare. We're not going to talk about all of them, but important to know that there's a couple of different categories, and that sometimes people qualify under a program called Disabled Adult Child, meaning that a parent has enough eligibility criteria for their child with disabilities to qualify for Medicare, even though they are younger than age 65, okay? So we're not going to go into too many details, but we wanted to let you know that there are 4 parts to Medicare. There's Part A, Part B, Part D, and Part C. The Part D is about prescription coverage. Part B is about the actual medical appointments, the tests, the screenings. Part A is about the hospital insurance, some of the home health care, nursing facilities. And Part C that's where Medicare contracts with private health insurance companies to offer plans. So Medicare plans through private health insurances, okay? And then some of the Part Cs also have prescription drug coverage. And by the way, not only on the Medicare website can you go through the eligibility steps to find out if you qualify, but Disability Benefits 101 is another great site. We're going to give you that website so that you can go through and see what you qualify for, okay? And before we move on, we wanted to talk about Medi-Medi, okay? How many people, thumbs up, if you've heard the term Medi-Medi before? Medi-Medi. So Medi-Medi is for folks that get both Medi-Cal and Medicare. Sometimes they're also called dual eligible or dual enrolled, okay? So what's terrific about that is this is a great example of generic services at work. So you're covered by both, but there are rules. So for example, Medi-Cal typically pays for certain types of out-of-pocket medical expenses with Medicare. And Medicare is considered the primary insurance for folks that are Medi-Medi. And then Medi-Cal kind of fills in the gaps. So there's all these rules about who pays first and who pays second if you have both, in this case, both generic services. And then I made mention here that Medicare provides access to more providers because the rates are better. And so Medi-Cal becomes kind of the gap filler here, okay? And then services that are covered by both programs will first be paid for through Medicare and then Medi-Cal. So whenever you have multiple programs or multiple systems that can pay for something, one of the things you should be finding out is who pays first, and then who pays second, and what do you have to do to make sure that the first system pays first and the second system pays second. And here's where, this is one of many times that we're going to plug benefits planning. We're going to give you some resources at the end of the deck of how to find benefits planners in your community. If you reach out to us, we can also let you know. Benefits planners are wonderful to walk you through your options, particularly when it comes to Social Security Administration programs, SSI, SSDI, Medi-Cal, Medicare. Benefits planners are terrific to help you find out exactly what you qualify for. Okay, so I see Jennifer's question here, and no, Medicare is not strictly income-based. So Medicare is based on if you've earned enough paying through taxes to qualify. So there's some time eligibility and some tax paying eligibility there. So people even that don't have a work history, if they have a parent that is eligible, sometimes they can, even if they're a young person, sometimes they can still access Medicare. And maybe Medi-Cal, right? Separately. Medi-Cal's a whole separate eligibility system. So private health insurance, we talked about this a little bit. This is the website for you, Covered California. Because if you don't have private health insurance through your job, and let's say you don't qualify, you make too much money, or you work too much to access Medi-Cal, you might qualify for Medi-Cal with a share of cost, or you might qualify for a plan that's affordable through Covered California. Okay, so that's the center where you can go to find out what you're covered for. All of the health programs and insurance programs that are offered there have all been considered. Covered California is where people go to find out what they qualify for. So you go to Covered California, you can find out if you qualify for Medi-Cal. You can find out if you cover for one of their other plans or a share cost plan. So Covered California, when you think of Covered California, that's the marketplace. That's where you can go to shop, so to speak, and find out what you might qualify for. All right. Thumbs up for people that know about California Children's Services. Who knows about California Children's Services?
Yeah.
Yeah. Okay. So a very quick rundown on this. This is a benefits program for kids up to 21 years old, but only with very specific health conditions and diagnoses. Okay. So this is not for everybody up to 21. And you can go on the website that falls under Department of Healthcare Services. So it's a state overseen program. And family income is considered as part of the eligibility, as are very specific diagnoses. Now, I'm just going to list a few. We don't have time to go into all of them, but some of those diagnoses are cystic fibrosis, hemophilia, cerebral palsy, heart disease, cancer, traumatic injuries. Those are a few examples of health conditions and diagnoses coupled with family income that may make families eligible for California Children's Services. And for those that do qualify, that can cover diagnostics and medical care. That can cover different health services and durable medical equipment and supplies. And then here's where we talk about that service coordination. So about 70% of kids that get California Children's Services, they also get Medi-Cal, okay? And then I wanted to point out that some of these services, even though they are medical and health related services, some of these can take place in a school environment or academic environment to help kids stay in school, even with significant health conditions and diagnoses. So really awesome program for those that qualify. And Elizabeth, you said that you had CCS services growing up?
Yeah, they have wonderful physical services and wonderful speech services, because I had both of those services, mostly speech. But yeah, it's a wonderful program.
Yeah. So you probably growing up, I know a lot of people that had Medi-Cal paying for some of their medical services, CCS paying for other medical services, their school district funding for services to help them in school, and then regional center services that maybe were funding things like respite. So that's like, you know, right there, 4 different services that are providing different supports or paying for different therapies at different times or different services, right? Yeah. So it's not easy. What you said was true, Elizabeth, that it's not easy, but it takes a little bit of time. Yeah.
That's what we talk about, navigating through services. That's what we mean.
Mm-hmm. Yeah. Yeah. And then, gosh, we could spend all night just talking about mental health and behavioral health care services. Big shout out to my partner, David Grady, who is doing fabulous, phenomenal work, organizing professionals, people with developmental disabilities and family advocates for systemic change and for better connection and service coordination when it comes to mental health and behavioral health care services. So bravo to the work that he's been doing.
Yeah,
So,
it-
yeah. So programs, county mental health and behavioral health care programs, they're operated at a local level, generally a county level. A lot of times that's through contracts between the California Department of Healthcare Services and the actual counties. But also the counties oftentimes are then contracting either with nonprofit providers or for-profit providers to pay for certain types of services and supports that they can't offer directly. And so when we talk about county mental health or behavioral health services, that can include everything from crisis lines, assessments, case management, crisis intervention, medication support, counseling services. We're talking about services for children and services for adults, including those with co-occurring conditions, meaning people that have formal diagnoses, both that are in the developmental disability category and in the mental health or psychiatric disability category. So this can also include case consultation. This can include assessing for specialty mental health services. And specialty mental health, that's a very specific term. That's a very specific list of diagnoses and impairment criteria that basically the state has set forward. So counties can assess somebody to find out if they qualify for specialty mental health or not. If somebody doesn't qualify for specialty mental health, they still qualify perhaps for some services, but there are certain sets of services and supports that are specifically for specialty mental health. And it's important to know that, let's say you happen to qualify for specialty mental health services or for different types of behavioral health care services, but you also have other diagnoses, including developmental disabilities. It's important to know that a person can receive services even if they also have diagnoses or conditions that don't fall under this category, okay? What I'm saying is that sometimes people experience discrimination because a doctor or an intake person or someone's doing an assessment and they say, oh, you have an IDD diagnosis, that you should go elsewhere for your service. But the law says you can have a diagnosis that's not in the specialty mental health category, as long as you also fit criteria or have the diagnoses or impairments that fit the list. So it's okay if you have more, right? It's okay if you have other diagnoses or other impairments, as long as you also have what's included based on what the criteria is for the program or for the set of services that are offered through that county. Okay, so important to know. And if you're concerned or you're worried that you've been told you don't qualify for something, reach out to your state council local office and we can talk you through it or help you find, you know, some of the specific eligibility criteria for what you're looking at, so we can help you determine your next steps there. Okay.
Sheridan,
Yeah.
it is 8 o'clock and I put a post on the chat that we want to open the floor up to questions at 8:15, 8:20. So I'm just going to ask you to pace
Yeah.
yourself. You have about 15 to 20 minutes.
Woo-wee. Okay, we're going to go fast. You know what, folks? We're not going to talk a lot about SSI and SSDI. However, what's important to know is that SSI, supplemental security income, oftentimes, but not always, is coupled with Medi-Cal, okay? You do not have to be a US citizen to get SSI. There's certain categories where you do not have to be. It does take a look at your earnings, specifically if you earn less than what is called SGA, substantial gainful activities. There's definitions for all of these. And SSI can be for both adults with disabilities and for children with disabilities that have limited income and resources. That's one of those that's associated where some of the eligibility is around income, okay? FYI, folks, if we have anybody out there with loved ones that are under 18 and have Social Security, keep in mind, once you or your loved one hits 18, it's redetermination time. So you want to prepare for that. So if we have anybody here that has teenagers in the house or young people in the house and they're on SSI, prepare so that by the time they turn 18, they're ready for redetermination, okay? Because there's a different definition of disability for eligibility in the SSI program. These are available on the website. And there's a whole, basically there's redetermination steps, including written notification. Generally, there's an interview with Social Security. There's a disability service review. So they see if now that your loved one or that you were about to turn 18, do you qualify under the adult definition? And then Social Security notifies you with the decision. So don't be caught off guard. If you have somebody under 18, prepare for redetermination for Social Security. SSDI, totally different program, folks. So this is a program that provides those cash benefits, but is not as dependent on regular assets and income. We talked about this a little bit when we were talking about Medicare, right? So there's no resource limit. SSDI does look to see if you're able or unable to earn certain levels of income because of your disability. And there's certain criteria about the amount of work that either you have under your belt or a parent. You might qualify under the Childhood Disability Benefits Program because you have a disability that began before the age of 22 and one or both of your parents is retired and is collecting Social Security. Or maybe you have a parent who has died and has earned Social Security when they were alive and working. So again, benefits counseling is the name of the game, but just know SSDI, different criteria than SSI, okay? And some people get both, all right? So some people, just like when we talked about their Medi-Medi, some people get Social Security and they get SSDI. So, and if you, let's say some people have SSI and then all of a sudden qualify for SSDI when a parent retires or becomes disabled or when a parent dies. So a person might receive both or might switch from one to another. Okay, so there's some good information on the Social Security Administration website, but it's important to speak with a benefits planner. We can also, there's links where we show some examples of how you can run the numbers yourself using some really reliable sources that will help let you know, okay? And by the way, these two programs are totally different from state disability insurance. That's that cash benefit for people that are oftentimes injured and are temporarily out of work. So that's yet a whole other program we're not talking about today. IHSS, you heard about this from Elizabeth. Basically, this is a program that provides generally non-medical or minimally medical services to people to help them remain in their homes. So a large percentage of people that use IHSS are 65 years or older, but you also have people that are younger than that, including children with disabilities that hit the criteria. And so the whole idea is that this is a more cost-effective and better service for people to stay in their own homes when the alternative is having to move out of their homes and into nursing facilities or other out-of-home placements. And it can provide a variety of services, including personal care, protective supervision, house cleaning, grocery shopping, meal prep, paramedical services, whole bunch of them, okay? And what's great is that many people that have IHSS services are able to hire people that they know to help provide these services and to get paid for some of this. We could spend hours on IHSS, but at least that's the long and short of it. So kids sometimes can qualify, people sometimes younger than 65 can qualify. Special education, I think if you're coming to us from Parents Helping Parents, you probably have good foundational knowledge under your belt about special education services, both when it comes to IEPs, Individualized Education Plan, or what's called a 504 plan, all right? We're gonna move on, but what's important to know is that if a child has a disability that's interfering with their access to their education, then it's important that that student is assessed and that special education gives instruction and supports and is designed to be individualized, needs to meet the individual needs of that child. And those special services have to be provided at no cost based on both federal and state law. and that there are specific mandates of how schools and other services need to be able to look for kids that might be eligible for services, okay? And then obviously there's many other components about the rights, including least restrictive environment, that services have to be offered in a least restrictive environment for a student, and have the opportunity to receive instruction with non-disabled peers to the extent that's appropriate. Anyway, we could go on and on, but so some folks just have 504 plans, which are mostly focused on access. And then many more have IEPs, or individual education plans. Department of Rehab. All right, so when we talk about Department of Rehabilitation, we're talking about all things employment. And by the way, Department of Rehabilitation has a much broader population that they are serving, greater than just folks that are eligible for regional center services. So everything from student services, transition services for students, vocational planning and consultation, skill development, career counseling, supported employment, assistive technology, a whole variety of different services. And by the way, Department of Rehabilitation also has work incentive planners, otherwise known as WIPs, work incentive planners. Those are at Department of Rehab offices, and they can provide intensive one-to-one benefits planning to help people understand how they can work and keep their Social Security benefits. So great resource there. CalAble accounts. Let me just plug this. We could talk a lot about CalAble accounts. It's a relatively new program, went live in 2018. Congress passed the overarching National ABLE Act, which basically told states, all right, go out and make these programs. And for eligible people, it allows them to be able to save many more dollars to pay for qualified expenses. Whereas oftentimes in programs for benefits, you're restricted of how much money, how many assets you can attain and keep. With CalAble accounts, it allows you to save up more of your earnings and other assets to pay for all kinds of things. So if you don't know about CalAble accounts, please take a look, because it's a powerful tool and it's a new tool that's only been available since 2018. All right, free and low-cost community programs. I want to see in Q&A or in the chat, can people give us some examples of community programs? And I think there's been some conversations in the chat about this. Park and rec departments, libraries, faith-based organizations, camps, nutrition programs.
Public transit.
Public transit. What else? What else have people used or are thinking of using in terms of community programs?
Sheridan, Marley says ILCs.
Yeah, I'm loving the ILCs. In fact, can I jump over that? I'm going to jump over that. ILCs. Marley, you read our mind here. So for those of you that don't know, great question, Irene. Independent living centers or centers for independent living, these are phenomenal organizations. They are designed and operated by people with disabilities for people with disabilities. And they serve people beyond, their eligibility is much greater than just people with IDD. They provide everything from tools, resources, workshops, sometimes one-to-one independent living support, making sure that people can keep their homes. We have some ILCs in the area that do a great job with housing, affordable housing workshops, and also accessible devices and accessible technology, and sometimes can rent those out. They also, ILCs have been incredible in the last couple of years of supporting people during the pandemic and also helping people prepare and have the supplies for emergency preparation, for fires, for earthquakes, for power outages. Really terrific. And you can find a list here in the Bay Area. If you're here in the Bay Area, we have an ILC in every single county. There's a whole bunch of them in California. There's at least a couple near you. So just wanted to let folks know that this is a wonderful resource for folks. And again, has a much more open criteria of who can access services. All right, folks. Regional center. Okay, so
You
here's
have
the
about,
deal.
do you have about 10 minutes, Shirley?
Yeah. So when we talk about regional center services, most of what we're talking about is what's called traditional services. Okay. Traditional services where you're with a regional center, the regional center provides that assessment, determines eligibility, you get your case management services, and then you're looking at various types of services and supports based on your individual program plan that says, here's the needs that I have. Remember, Elizabeth was talking about building a plan that says, here's all the things that I think I need to live my adult life the way I want. So that's important. And that IPP might talk about some generic services, but probably also identifies supports and needed services that the regional center can fund. And in a little bit, I want to pull up a terrific cheat sheet of sorts that tells you some of those service categories that regional centers offer, because we get that question all the time. You can access it, by the way, that link at the bottom there will provide you with this cheat sheet of the general service categories in, I think, at least 7 languages, if I'm correct, plenty of languages. So again, the secret is person-centered planning and an individual program plan that's accurate and updated. By the way, if you or your loved one is 0 to 3 years old, it's called an individual family service plan. So IFSP instead of IPP. And then, as many of you know, services are provided either through vendors or through other resources. So your service coordinator is not the one that's providing the services. And by the way, if you haven't been to an IPP planning or an IPP rights training, either through the state council or through Parents Helping Parents, go to one, because there's a lot of rights and rules around how to get the most out of your IPP to make sure that your IPP is a document that supports your goals. Okay.
It's like a living will.
Mm-hmm. Yeah. And we want to point out too that there are other ways for people to access services funded through Regional Center. One way is through self-determination, which is a way where the person with the Regional Center services has more control over their budget and where they can spend their money on, including they can do more direct hire or contracting, including with people that are not currently vendors of the Regional Center. Okay. There are orientations and info sessions about self-determination. So if you have Regional Center services and you're thinking that you might want more choice and control over what services you purchase or who you purchase to help you, reach out, get more information about self-determination, because this is a relatively newer way. It's been around since the late 90s, but it's fully out and available for anybody who qualifies just in the last year, since last summer. And there's a few different roles. There's some new roles and new parts in the red you can see of self-determination compared to traditional services. Okay. All right. And then last part before I show you a handout, and we have more discussion here, which is that Regional Center also has certain services that can be participant directed. Okay. Participant directed. So basically, and this was really expanded during the pandemic. So what it meant is certain services like respite, daycare, transportation, nursing and day services, some community-based training, certain services may be available to be participant directed, meaning that the Regional Center can provide people with the option to exercise more authority over who provides those services for them. So the person served would have more of it, what they call an employer authority, and can have a little bit more choice in choosing and scheduling certain types of workers for this. Now, there are directives that are coming out because a lot of the participant directed services were time limited and were extended during the pandemic. And it requires people, if they're choosing participant directed services, there's criteria and certain financial management services that you have to work with. So if you're interested in that, there's more information in your Regional Center, or your state council office can tell you more about that, okay? All right, so I want to let you know one thing. We have pages and pages of resources for you. Okay, pages and pages. We're not going through that. What I'm going to do is I'm going to stop share because I want to share something else with you all. And as I'm pulling that up, folks, David, can we get some good questions or discussion?
Well, we have
points?
3 really good questions. I was all ready to answer them and then thought, well, I'm going to have to write a book if I try to answer some of these questions.
Gosh.
So we'll
Yeah.
we'll take a stab at them. One of the one of the points of tonight is it's a navigating services. So even though we're giving you a lot of how the regulations are written, and what you can expect when working with regional centers or trying to get or being told to access a generic service, you will have to use your advocacy skills and talents to navigate. And what I mean by that is to work in collaboration with your service coordinator to maximize the services your child receives through her IPP. So for Daisy, she asks, where can I find again if my daughter qualifies for Medicare? And I'm not sure if Daisy means to ask for Medicare, which is the insurance benefit associated with your work history versus or your age versus Medicaid or Medi-Cal, because that'll steer our answer.
Yeah.
And we need to know how old your daughter is as well.
And Daisy, on the links that you're going to get in this deck, that takes you directly to the spot where you can look at eligibility. And by the way, folks, I showed in English and now I'm showing in Spanish, service categories and descriptions for regional center. These are general categories, okay? So you're going to get these in your email also, okay? So it lets you know a little bit of the types of services that are commonly supported or commonly funded. Okay,
so Daisy, if you raise your hand, we will let you speak. Let me exit full screen. There we go. And then in the meantime, how do you get in touch with a benefits planner, RE, SSI, SSDI?
Yeah.
So Sheridan, you mentioned the WIPs over there at Department of Rehab. Do you want to give a little bit?
Department of Rehab has some benefits planners. Also, ILCs, independent living centers, oftentimes, most of them also have benefits planners. And I think there's a link on Disability Benefits 101. That's where they have like cheat sheets, lots of great information, worksheets for you. They also have links to benefits planners. And if you talk with your regional center, oftentimes regional centers also have resources to connect you with benefits planners. And sometimes regional centers can fund for you to work with a benefits planner if there isn't a low cost or no cost one accessible in your area. So important to know. Yeah, benefits planners are fabulous, really, really terrific. And they go through so much training. So these are people that are so steeped in benefits planning, much beyond what most of us do day over day.
Yeah.
So
their knowledge base is much broader than ours. I really encourage. There are not enough benefits planner for the people receiving benefits. So be patient, schedule your meetings appropriately, and make sure you get that time to do it. And then finally, this is from Anonymous. Does SSDI benefit a child of any age of a disabled parent, or only? Then she asks under 18, and if receiving SSI and SSDI, would SSI be counted as income? So Sheridan, I'm out of. I need a refresher on those questions. What do you know about?
Yeah.
Those?
So SSI has more specific income and assets requirements than SSDI. SSDI, and this is abbreviated, right? Because it's many multiple steps eligibility, but SSDI is looking at, for lack of a better term, your work credits, your years worked or your months worked in tax paying, either you yourself or a parent that's eligible for Social Security because of the amount of years that they've worked. So if you have a parent who's retired, a parent who is disabled, or a parent who is dead, and they have Social Security benefits, if you are a child, an adult child with a significant disability, you may qualify to get that. There are different programs under Medi-Cal. One of them is the Disabled Child Program. So that means that even though if you haven't worked, you might be eligible for SSDI based on your parents. And there's other categories of Medicare that are exclusively focused on how much you've worked and what you've earned. So there's a few different categories.
A
I
good way
want to
to,
share.
Sharon, I like to kind of say that what gets confusing is that there are two different pockets of money,
Yeah,
but they're administered by the same agency. And that's where which is the Social Security Administration. And that gets people
Yeah.
confused. But think of SSDI as your insurance. It's an insurance program. It's one of the benefits associated with receiving or having paid into Social Security, which is your work history. SSI is more of a welfare program
yes,
based on the need of your child not being able to work and having a disability.
yeah,
So you will always be required to take SSDI first,
yes.
and
Even
then
if you qualify for both. Mhm.
yes, and then SSI will fill in the amount to get to what is the term? Your federal benefit rate, which is
Yeah.
what you should receive per month from the government for people with disabilities.
And there's calculators on Disability Benefits 101. You'll get that email, that website address in your packet. So you can actually run the numbers based on your situation to find out roughly what those benefits would be. I want to point out, folks, one of the handouts that you're going to get in your packet from PHP is the top 5 actions you can take to access generic services, okay? Including definitions, including how to find what you qualify for, how to document, because remember, if you have multiple services you qualify for, and you know, for example, regional center is the payer of last resort, that means you need to document what you tried to get from other resources, including having denial emails or denial letters. So this is important. Number 3 here talks about how you need to document what you're eligible for and document when you have systems that tell you no, that say, no, we won't pay for that therapy, or no, we won't pay for that durable medical equipment. And then there's always appeal rights for every system. If you don't agree with the decision, when you get told no, that you're not going to get funded for something, there are appeal rights and timelines. You want to read that information carefully and keep all of that. That's going to help you secure the service that you need, either from one service or from another in many cases. Okay. And then
So we have
there's
2 more
other-
questions, or we have a Daisy has kind of gotten a little bit more detail. So Daisy, your daughter is an adult
Mhm.
and she qualifies for Medi-Cal. So we're happy she's getting Medi-Cal. So
Yeah.
you can call Medi-Cal up and they will tell you if your daughter should be receiving Medicare, because Medi-Cal, they do not like to offer Medi-Cal because they want you to take advantage of the insurance associated with SSDI or DAC.
Yeah.
But a good indicator for you, Daisy, is if you are retired or your husband is retired, or if your husband or yourself are on disability, your child, as a benefit of Social Security disability insurance, may also get Medicare. So complicated answer to a simple question.
Yeah.
And then
Just because you get one doesn't mean that they're going to tell you that you qualify for more. Many times you have to apply or to check out, for example, a benefits planner, or at least go on Disability Benefits 101 website and look at the eligibility. And by the way, there's additional links on this handout that you're getting.
yeah,
I
great.
also want to say real quick, if your child decides she wants a job, she could work part-time and still receive SSI.
Yeah.
Yes, you can
Yeah.
continue. There are work incentives associated with receiving SSI and SSDI. Thank you,
Yeah.
Elizabeth. Okay, Virginia is asking, and Sheridan, you want to take this one? She has a 5-year-old who's been recently diagnosed with autism. I see.
David, are
maybe I'll
reading
read it.
for us?
She's diagnosed with autism, waiting for a special education evaluation from school district and also from regional center.
Yeah.
Do I need to wait for all those evaluations are done before contacting social services to get him benefits?
So, great question. The answer is no, because the eligibility for Medi-Cal, for SSI or SSDI, SSI in this case, that is different than what you're going through, than the assessments that you're going through in school, and it's different than the assessments that you're going through for regional center. So different systems, different assessments. So what you can do is you can go on, whether it's DB 101 or the Social Security Administration website, and start to go through the eligibility criteria for SSI for your child. You can start to do that now to see if they qualify, and that will be a different process than what you're going through within the school district, different process than what you're going through at the regional center. You can do all those, you can start those processes all together. Many parents do, and then they rip their hair out because it's like, that's a lot to manage. But if you feel up for it, do it. And most families do both work within the school district system or the healthcare, go through healthcare to see what services, particularly for a child with autism, they're working through their health insurance while they apply for regional center. So that's very common for you to be kind of seeing what you're eligible for in your healthcare, and then also seeing if your child is eligible for regional center services. Let's say you get into regional center, you're still going to want to see and use whatever your child qualifies for through the school district and through their healthcare before using any regional center services. You can still be a member, so to speak, right? And have your case manager. It just means before they pay money for services, they'll want to know, has your child gotten everything that they're eligible for through their healthcare insurance and through their school district before the regional center cuts a check for a certain service or support.
Right. And usually for children, that regional center, for most families of children, what regional center purchases is respite services.
Yeah.
Now,
Yeah.
so Virginia, the diagnosis of autism, that is your medical diagnosis. So that's a medical diagnosis done by professionals, psychologists, educational psychologists. That is that you need to always keep that diagnosis close, because that is the qualifier. But now your special education evaluations are done to find out what the child's IEP should look like. So what goals and objectives should the school focus on to maximize your child's education? And then your regional center evaluations, I'm not sure where you are in that process, but those evaluations would be mostly to help you to figure out your IPP. Your medical diagnosis of autism is prime, but it does not hurt to have solid special education evaluations and regional center documentation. All those you utilize when requesting service to maximize your benefits.
Yeah.
So long answer to a short question again. Okay, we have
the generic services.
Yes.
And document. You want to document everything.
Yeah.
Down to the
Hold on to that. Parents Helping Parents frequently has a training on how to manage your records for your child. So get a big 3-ring binder, get some dividers, and all the papers that you have, make sure they get filed away. Get more than one 3-ring binder.
Yeah, absolutely. And to
Okay.
Elizabeth's point, documentation is the name of the game. Keep good records. Yeah, and when you get denied something, look at what your rights are to appeal or what your next steps are. A denial isn't the end. It basically tells you what your next steps are. Your next steps may be to pursue it with another service system. Your next steps might be to appeal a decision. There's always potential next steps. So read the paperwork that comes with any denials from healthcare, from schools, from regional centers, from Medi-Cal. Yeah.
So we could go on all night. We've just, again, it's another tip of the iceberg sort of thing. Sheridan and I are, and I'm going to even put Stella in our category, and Pete and Alyssa, you're a part of the team too. We are the wonks. We somehow get our warm fuzzies out of knowing all this information. So feel free to depend on your advocates to give you guidance. And Sheridan, you've done a hero's duty. Did you make it to all the slides?
You know what? All of them except the resources, which you all are getting in your email. So don't you worry.
So
I'm
that's
gonna
over
send
60 slides, everybody. 60
more
slides.
than that. So guys, you're going to get a whole mountain of stuff in your inbox in English and Spanish. And again, our big thank you and congratulations to Stella, who has done such the hero's work of both interpretation and much of the translation that you saw tonight. And she said she might even help us with translating a little more in the near future. So
Yeah, she's a great
eternally
resource.
grateful. Eternally
Wonderful.
grateful.
Sheridan, thank you. Guests, thank you. Parents Helping Parents, thank you. We really love to be a partner with Cal Connections. And then to find out about information regarding next Thursday night's presentation on intellectual and developmental disability and behavioral health, go to the PHP website, go to Cal Connections, and register there. And we will see you in a week. Elizabeth, I thanked everybody, but the final thanks goes to Elizabeth. No experience is as important as the lived experience. So Elizabeth, thank you very much.
You're very welcome. I give my knowledge to working so close to Sheridan. She's like, we're partners in crime. Whenever she doesn't talk, she brings me along to co-present, so we feed off of each other.
Yes, Elizabeth, we appreciate it. This is inspirational to have our self-advocates co-present, and we do it as much as we can. All right, everybody, I'm going to hit the end button here. Take care.
Bye.